Okay, you're live.
You guys come on in close. It's Dr. Emer. How are you guys? We are doing a Permea Clear and Brilliant treatment of the lower leg between the knee and the ankle. And this is one of the things I'm really glad my patient's letting me show you because I wanted to talk to you guys about golfers and tennis legs. What is that? Does anyone know what golfers or tennis legs are? These are my women that go out in their little skirts in the summertime playing golf and tennis. They're looking cute, and then they develop a basal cell cancer on their legs. So one of the things we do to try and prevent aging of this area, but also discoloration, risk of skin cancer and sun damage, is we do laser treatments. And one of the treatments you can do when you don't have a lot of downtime, probably the best treatment for this would be actually to do the Fraxel laser with IPL in a combination, and then do Cosmetic or other type of peels regularly. But when you don't have that downtime, we can treat this area with the Clear and Brilliant Permea, which is the 1927 wavelength. And this wavelength specifically targets pigmentation and sun damage in this area. So if you have an uneven skin tone, you have sun damaged cells, pigmentation, etc., we can use the Permea to start to treat that area. And that's the one thing I wanted to stress today, is it's extremely important that my patients that go out in the sun, especially here in LA, are always exposed to the sun, but in other areas of the country or world where maybe you have a winter and you don't think, and then you go in the sun in the summer and you're always out there, you're at risk for developing skin cancer and sun damage. This is very minimal pain. We're focusing on each area, particularly the shins, because it's an extremely high rate of people developing, like I was saying before, skin cancers and sun damage here. But this is going to give her a nice even texture and tone and keep everything looking smooth, younger, healthier, etc. Now I also have a lot of women, did they say anything? I also have a lot of women that get bumps when they shave and develop either keloids or pigmentation. A lot of my darker skin patients will get acne. This also can treat that along with salt facial or another facial. You do facials and peels, no problem.
Is there any downtime for this?
This has minimal downtime. It really is just a little redness and a sandpaper-like texture. So it's not too bad.
And did you pre-treat the skin in a
Oh yeah,
way?
you guys know how crazy I am with skincare, because I truly believe it makes a huge difference, especially stem cell products, both for anti-aging and discoloration. So long story short, we pre-treat this area with vitamin C, kojic acid, and growth factors, and retinols. And you should treat this area just like you treat your face and your hands, neck, or chest. And so how this works is small beams of energy are being delivered into the skin in microscopic channels, so you don't really notice so much what's going on till the next couple days when you feel a sandpaper-like texture. It's not painful almost at all. It's very minimal pain, which is I love.
How often can you do this treatment?
Listen, when we ran the original studies for melasma, you could treat it every 3 weeks if you really wanted. But in something like this, I would say stronger treatments every 3 to 4 months, like a Fraxel. You could do this every 6 to 8 weeks, unless you had a reason to do it more often, like a burn or scarring or pigmentation. Then you can maybe go every 3 weeks at the beginning, and then you slowly taper off. And you guys can see on the other side, it's starting to get a little red. Does anyone know, the lower legs have less blood supply. You remember, the blood has to pump away from the heart. So the further away you are from the heart, the harder it is for lasers to heal. And so you guys know, in this case, we're treating the legs. That's why legs, it's very important to do lighter laser treatments consistently rather than super strong laser treatments because it takes much more time to heal.
Is this safe for darker skin?
It is. You can use the Permea wavelength on any skin type if you want. But again, all darker skin types will require more treatments to get a good outcome. So that's really it, you guys. This is the treatment. We're going to keep going on the full area. Make sure it's all blended. And then we're going to do the other side. Any other questions or no?
That is all.
That's it. So that's Clear and Brilliant for lower leg, sun damage and rejuvenation.